This is High Stakes from Jarrard, Inc.
I'm David Schifrin with Jarrard, Inc. Today I am joined by one of my colleagues, Ellis Metz, who's Vice President of Strategic Partnerships in our Health Services practice. A couple of weeks ago, Ellis had a conversation with Dan Beuerlein, Managing Director at Brentwood Capital, and thought that it was the type of conversation that we should bring to a wider audience to look at kind of what's going on in the capital markets and on the banking and investment front. So Dan advises health services companies on M&A and capital raising transactions. He's done a huge amount of work across different sectors, particularly autism services, a lot on women's health and fertility, outpatient surgery, and much, much more. Throughout the conversation, we also reference the latest edition of our National Consumer Survey, where we surveyed adults across the country about their perception of PE and post-acute sectors. So you'll hear that, and you can also get your copy of the survey at jarrardinc.com. Dan, it's great to talk to you this afternoon. Thanks so much for your time. You're not supposed to date podcasts, but I will because we're right in the front end of March Madness. And so everybody here is keeping one eye on the scores. And just appreciate your time in the middle of all that.
Go for the NIT. Can't spell NIT without Vanderbilt or something like that.
So Dan, I'm hosting this conversation, but we've also got my colleague Ellis Metz here, and you all have been talking for a while about what you're seeing in the market, and definitely want to give you two a chance to kind of continue that conversation. But as a broad overview, talk about where you see healthcare investing, healthcare finance today. Just kind of give people a little bit of a sense of your worldview.
Sure. Where we play as a firm, with my firm Brentwood Capital, we're a sell-side advisor in the lower middle market. For our clients, that typically means usually still founder-led businesses. They may be professionalized to a certain extent, but predominantly they're going to be early-stage businesses that have been around a few years from a financial profile. They're usually evaluating a blend of raising capital to fuel their growth, or in some instances, they're looking for a complete exit. They're looking for a sale of that business.
We provide advice, expertise, and spearhead the process to help our owner clients achieve their liquidity goals. We give them advice on building value, understanding our clients' priorities, their valuation expectations, and really devise the best strategy to market their firm for the best outcome, whether it's a full or a partial sale. We also represent both founder-owned businesses as well as those owned by private equity.
By background, I spent about 20 years in various healthcare sectors as an operator, about 10 years with a Nashville-based surgical center company called Symbion, which is now part of Surgery Partners, and then worked with private equity over the last 10 years roughly as a chief development officer, essentially being the M&A engine for those funds that are investing in healthcare. My role, in whether I was working in behavioral health or women's health and fertility, IVF clinics, autism clinics, and most recently home health and hospice, was to essentially take the base business that usually had been started by the acquisition of a founding entity by private equity and then build upon it. At a broad level, investors see healthcare as a positive place. It's often recession resilient, as they say, and as levels of coverage for certain types of services and or conditions continue to improve, there's always going to be a robust market for folks looking to make investments to hopefully, in the grand scheme of things, make service delivery better, provide more access to patients, and make the process a little more streamlined for the operators that are delivering that care, whether they be physicians or whether they be large companies with facilities.
Dan, last time we talked, we were talking about market outlook, and I believe you said the soup du jour was cautious optimism. Wanted to see if you still thought that's what people are serving and if you're buying it.
The JP Morgan Healthcare Conference, held in January each year, is what typically sets the stage for overall market sentiment and investment themes to expect in the coming year.
Some consistent themes continue to come out of those discussions, as well as subsequent industry-specific conferences that have continued through the first quarter. Cautious optimism is the soup du jour. The pot's getting ready to boil, if you will, to keep riding this imagery here. I think it's an environment also that's being fueled by with what we've seen over the last 18 months with the credit markets, when investors don't have an idea or confidence in which way the markets are going to go, whether interest rates are going to go up or down, they simply take their money off the table. And that's what's happened with deal flow over the last 12 to 18 months, is that uncertainty within the interest rate market and the lending market kept a lot of money on the sidelines. And then if you continue to walk backwards in time, we've just come out of the COVID pandemic, where again, uncertainty and the inability to really do significant diligence on assets. Although COVID was a very busy time for M&A, many deals were done sight unseen. You had folks doing diligence virtually through Zoom. It actually, in many instances, I think the pandemic heightened investors and operators' senses as to what can be done more efficiently and what doesn't have to be done in person. That optimism, I think some of it might be wishful thinking. I think it's maybe a self-fulfilling prophecy. Many of these assets they're vintage investments that were made in 2017, 2018. And if it's a private equity fund, their typical hold period is 4 to 6 years on average. And they're long in the tooth, so to speak. COVID set everything back a couple of years, and then the credit markets put a damper on that as well. So you've got some assets that have been in their hold periods for 6-7 years, while the ability for that, and that affects the private equity group or the fund, because their ability to go and raise the next fund, which is really what they want to do, is hindered because they haven't divested the assets in the previous fund and return those dollars back to their limited partners or to their GPs. So those two things alone have really stretched the time window for investors. And because of that, now that there is fairly good confidence in the fact that there will eventually be some rate cuts. So with all of those things coming into play, I think investors see this as finally the light at the end of the tunnel. So there is a lot of activity currently. So if we're going to use the kitchen analogy, call it the sous chefing part of the deal, right? Paella takes 30 minutes to cook, but you have to chop up stuff for 2 hours. That 2-hour chopping up and the sous chefing that's going on, that's the activity that you see on the legal front. It's the activity that you see with the quality of earnings firms. It's the due diligence, the clinical diligence requests on the sell side. So all of those engines are starting to turn, and that is signaling to the market that, okay, buyers are ready, sellers are ready, let's go.
I'm starting to get hungry, but it sounds like the deal process has evolved some in recent years. And one of the things that we at Jarrard talk a lot about is trust and how providers can build trust, how sponsors build that reputation over years. Can you just talk about the role trust plays in the transactions you're seeing?
Certainly I'll look at it through a couple of different perspectives. As a buyer, my role would be to take something to our investment committee, and they are putting their trust in me as chief development officer or whatever that role may be, that the information I'm bringing to the table is accurate, that the founders and the leadership of the company that we're looking to acquire that they're ethical, that they're good leaders, that they can take the company, if they are going to be continuing on with the organization, that they're the right people to lead that organization forward, just under a different umbrella. You've got to build the trust from the seller standpoint, and essentially that's what the diligence process is, whether, how you can communicate to your investment committee that, this asset relative to other alternatives for our money and for our funds and for our capital, this is where we should place our bet. And that bet comes on the trust that's built through the diligence process. I think you and I we had a little conversation at one of the recent transaction conferences about what I saw in my role as a buy-side executive. I often felt like I was playing the role of a sell-side advisor when they didn't have one, because just if you're going direct to a potential acquisition target as a buyer from a strategic organization, you have to get them to trust you just to get them to the table. Why would I want to take my family business my practice that I've been running since I got out of med school? Why would I want to entrust that into someone else's hands? And just to even have that conversation, you have to build a rapport and build a relationship between the buyer and the seller.
We typically spend years building trust with our clients before they're even ready for a sale process. And it's that relationship that's the foundation for them engaging Brentwood Capital as their advisor to find a trustworthy buyer for their business.
And I was interested in your study too, just evaluating the ways that the public either has trust or maybe is critical or skeptical of investors in the healthcare sector. But yeah, I think that's what sparked the conversation, and happy to dig in further, but really enjoyed reading your report.
Thanks. Yeah, I appreciate that, Dan. Any other accolades you want to send our way? I'm here for it. You jumped right in with sort of the question that I was going to ask. You signaled the transition there a bit. It's, so we talk about the trust that's necessary between all parties within a deal, making sure that the representatives, like not just the two folks on the other side of the table, but their representatives, the bankers groups, that everybody has a good relationship to be effective. And so then, I'd love to expand that out into the relationship between the organizations, the care providers, and the investors with the public, with the people who are ultimately receiving the care that is going to be affected by the deal. And so just to set up for wider audience, we've just published our post-acute and private equity survey. It surveyed 1,000 people across the country about their perception of the post-acute space, as well as kind of try to gauge their understanding of private equity and healthcare. So very much a what does the public think approach. And as you said, we saw that hospitals and health systems are the most trusted when it comes to improving healthcare in a few different ways. Investors are middle to lower part of the pack, and people do assign a financial motive to investors when they get involved rather than a patient-centric one. But then at the same time, at the end of the day, a majority don't really care. They say, as long as my care is good, I don't care who's funding it. I don't care what the business model is. Just take care of my health needs. And so I'd love to hear more about your perspective on what the relationship between the organizations, the investors, and the public looks like with that context.
Yeah, it's a great question. I think it really depends. It often depends on the space, but I think at a high level, and I've said this a million times in conversations with small mom and pop businesses that may be considering partnership with whichever organization I'm with, is that private equity it's just a bank. And at the end of the day, there are good organizations within the banking world. There are bad organizations within the banking world. So part of the magic of what we do on the banking side is to try to find the right fit for our clients to make sure that the folks that we're introducing them to are trustworthy. Because we've worked with them in the past. We've seen how they operate with their portfolio companies. We've seen how they treat their founders post-close. We've seen how their organizations have grown and prospered and gone on to do great things. And there are certainly examples where private equity they've made mistakes, they've gotten greedy, they've stubbed their toe. When you compare what you would call an investor-owned hospital, call it HCA, they're the largest, they're a publicly traded company. If anyone is subject to scrutiny and a transparency requirement over and above many other healthcare providers, it's them. And there's always some story going on, but what you often don't see news reports about the great things that for-profit healthcare operators are doing. You don't see attaboys for investing hundreds of millions of dollars to build out new service lines and to bring access to care into markets where it previously didn't exist. So from the public's perception or from the public trust of their healthcare provider, it certainly obviously matters as to the sector, whether it's a facility-based organization or whether it's maybe a tech-enabled service. But as I was reading some of the commentary here, one thing I wrote down, and it just stood out to me, is that where you say hospitals are the most trusted when it comes to improving healthcare, I asked myself, why is that? We're brought up to understand that when your life needs to be saved, you need to go to a hospital. So from an early age to when you know what an ambulance is, you view that hospital as something that saves lives. And I couldn't imagine a scenario where you didn't trust that. Don't take me to a place that might save my life because I don't trust it. So to find people that even say that they're skeptical of their own hometown hospital, that's a pretty heavy lift. Now, to say that people are skeptical of private equity's motives, I would also almost twist the question around and say, if you tell someone that person A has a profit motive and person B does not have a profit motive, I think just by nature, people are going to trust the one with, quote, without a profit motive. And it's not as simple as comparing a profit motive for profit to nonprofit. And I've always argued that the incentive for profit isn't good or bad. It's what you do with it. And one note that I jotted down here is that it doesn't matter if it's monetary or not. How you get an outcome, a desired outcome, is you provide an incentive. Incentives drive outcome. I would also argue that profit incentives will drive outcomes. They can be good, they can be bad, but the broad brush that the public can often paint, or that the media can often paint, that for-profit healthcare is bad and the profit motive in healthcare is bad and it's detrimental to the public good. I disagree with it fundamentally. I spent a good bit of time in the autism sector as an operator, doing acquisitions. I sit on the nonprofit board for the state of Tennessee, for Autism Tennessee. I cover the autism sector on behalf of Brentwood Capital. And the money that private equity has pumped into the autism sector for the delivery of services is mind-blowing. It's one of the most active sectors over the last, say, 5 to 8 years. And there have been some very high-profile stumbles where very high-profile private equity firms have declared bankruptcy with their autism platforms. So against that kind of backdrop of for-profit motive is bad, there should be no private equity in healthcare, or especially in autism services, the counter argument to that is, who is willing to take the risk and provide all that capital to provide those services to the communities? I would argue that private equity has delivered hundreds of thousands of hours of much needed care to communities that previously had no access, and some lost their shirts doing it. So you can vilify them all you want, but understand, without that profit motive, those services never would have been delivered. And to me, I think that light has to be shed on that argument far more often than it currently is. It's easy to get folks' attention with an eye-catching headline about fraud, waste, and abuse. It's easy to get folks' attention with a news story, about someone that was caught stealing money from the Medicare program. That's simple, but it's a weak argument.
I realize this is more how we spend our day-to-day job, but how do you think about storytelling for private equity? How can they get a better story out there and potentially sway public opinion in their direction?
I think some do a really good job of it. I do. Many private equity firms have what they call impact funds. So the purposes of those funds is to invest in sectors where services are underbedded or understaffed, and a portion of those funds are earmarked for philanthropic causes. I think that's one avenue. It is a double-edged sword. I could probably name 10 hospice acquisitions as an example that have taken place, but private equity doesn't want to do a press release on it. They would rather just make their money, or they'd rather make their investment, hopefully deliver a return for their investors, deliver exceptional care for their clients, sell the asset, return the money to their founders, and just be quiet about it, because there's just too much headline risk if something goes wrong. And you'll often see that in behavioral health sectors, or especially in things like IDD, intellectual disability, some post-acute services. Folks would just rather make their investments and be silent. You're seeing that more, and that's the sandbox that you guys play in. So it's how they can better tell their story it seems simple, but it's tricky. But when a new community clinic is being opened, have the ribbon cutting, I think the biggest thing to do, though, is to do it without it being a commercial for the private equity fund, and having it be a commercial for the urgent care clinic or the new fertility clinic or the new imaging center or whatever it may be.
Well, Dan, this has been really interesting. And as we come to the close of our time, I would love to ask you sort of that catch-all question of what has you excited these days?
I think you'll be happy to know I'm not going to say artificial intelligence or machine learning.
Very happy, thank you.
To that one. I guess I'm done here. No, I think
What else is
I
there?
look at the sectors, yeah, right. As I look at the sectors that we cover and that we represent, many of them, like most, over the last 3 to 5 years, well, especially after the last couple of years through COVID, especially, are facing tremendous pressures from the staffing side of the house. It's hard to find caregivers in post-acute. It's hard to find caregivers in hospitals and surgical centers. It's hard to find caregivers in the autism services sector to keep with the demand, the incredibly fast-paced rising demand in diagnosis. It is a technology angle. I'm not going to say that it's all going to be driven by AI, but the tools and the improvements that are having to be made just to deal with the current environment are forcing organizations to become more efficient. They're forcing them to revamp their processes and reevaluate their processes of what is really value added that the customer cares about and what's really not, right? By training, I'm an industrial engineer, but prior to healthcare, I worked for General Motors building Saturns down in Spring Hill. And it is all about efficiency. If the movement or the part or the time or the input doesn't go into the final product and the customer doesn't care about it, you get rid of it. We've always said that healthcare is 30 years behind manufacturing with implementation of lean systems and the Toyota production system, all the things everybody learned in business school 25 years ago. That I still think is still progressing at almost still at a glacial speed, but COVID exacerbated it. I think the for-profit motive actually helps spur some of that innovation and that goal of making things more value added and making it more important to the end user, to the customer, whether it be the surgeon or the physician or the nurse or the patient. The technologies and the new innovations that are coming out to drive that efficiency in healthcare, I think that's what gets me excited. When I talk to a potential client or even a portco of a private equity firm that we know that's doing some really interesting things to address this pain point, and those pain points often center around staffing. They center around the human capital that's needed to deliver the care at the level that everyone's come to expect it. There was some commentary in here around potential government regulation of staffing levels at nursing homes. If you want to give a healthcare organization the legal right to be inefficient and status quo for a long time, let the government tell an organization exactly how many people they need to do something. I'm a free market guy at my core. Understand that healthcare is different than making cars, but there are certainly some things that the system can learn from industries that have forced to become competitive because of outside pressures. They have been forced to become efficient and deliver high quality care because the patients demand it. And if they don't get it, they don't come back. In the past, the mentality has largely been around at the system level that we own the patient. I think the patient is also getting far more adept at self-identifying and saying, I think I want to own my care now. I don't want to turn it over to you and just do what you tell me you think I should do. I've talked to a couple other second opinions, or I've seen alternative delivery models of care. I think I want to go over here for my procedure and not come downtown and park in a massive garage and be at the hospital all day for a routine colonoscopy. I think I'm going to go out to the surgery center just down the street from my house. It's that innovation that gets me up. I've certainly enjoyed my time as an operator in that world, and it's fun to be on this side of the table as well.
Thanks, Dan, so much for your time. It's been fascinating to hear your perspective. And as I alluded to, I always love when people kind of speak the Jarrard lines about storytelling and getting the message across. And I know that Andy Slavitt was on stage at MWE's HPE Miami conference a couple of weeks ago saying the same thing. But just love your perspective and really appreciate your time.
Yeah, absolutely.
The JP Morgan Healthcare Conference, held in January each year, is what typically sets the stage for overall market sentiment and investment themes to expect in the coming year.